Hey everyone, I'm Travis and this is Abby. Welcome to Concussion, the podcast where we dive deep into the world of brain trauma, breakthrough treatments, and inspiring recovery stories. Whether you're an athlete, a survivor, or just curious about how the brain heals, we've got you covered. Join us for real stories, expert insights, and plenty of eye-opening moments along the way.
I'm Abby. I'm a physical therapist, and I'm excited that Travis and I get an opportunity to use the experience that we had as a catalyst to be able to make concussions a little bit more familiar. So whether you've sustained a concussion yourself, have a family member who suffered from one, or just know somebody in your life who things change for them after sustaining a concussion, we're hoping that we can kind of allow this to be a resource for you, and also kind of share with where things are on the healthcare side of things. You know, where the opportunities are for us to be a little bit more aware and realize how this influences people, and also put some language and familiarity behind what happens after a concussion. So I thank you for organizing all this, and I'm honored to help share some of what my experience is, so that way we can answer questions from folks and tell some stories behind what happens for us.
Yeah, and thank you so much for being here to share your expertise and your knowledge. I'm excited to do it.
Yeah, I'm honored to be here. So we'll start off with where things were for you, and we'll go from there.
2016, I was in a pretty bad motorcycle accident. I was in New Jersey racing motorcycles, not on the street, on a track, all sanctioned by every professional agency. You know, nothing illegal. I was going about 130 miles an hour down the straightaway, and there was a mishap, and I woke up 9 days later. And the last thing I remember was I was on the track, and my friend was in front of me, and he kind of moved over and waved me along, and that's the last thing I remember. I remember saying on my head, finally, he got out of my way. So, and then 9 days later, I wake up in a fog, and so many things happened. But this this whole incident, which will be explained more shortly, led me to meet my new friend Abby, or old friend, I guess.
Yeah, so that was about 9 years ago now, wasn't it? And I appreciate you being so willing to share, because this opportunity to talk about it is going to make a huge difference for a lot of folks that have either sustained a concussion themselves, have a family member who's suffered concussion, or know of or lost a friend that's sustained a concussion. And this experience that we've had is a good catalyst to kind of open up these discussions and hopefully bring a little bit more familiarity behind what happens with a mild traumatic brain injury or a full-on traumatic brain injury. So thank you for being willing to share this and allow me to kind of chime in a little bit, so that way we can shed some light on what happened, and where things are now. And things changed for you in an instant. So before this accident, had a great job, married, raising a daughter, and had really cool hobbies.
Yeah, exactly.
And then all that changed. And your resilience through this is definitely the success story. But I think your willingness to talk about the challenges that you experienced might make more sense as to why not everyone is as lucky to say they're on the other side of this in a successful way. But take me back to what you first remember, waking up in the ICU. What were things like when those first few conscious moments came to you?
So I've always said to that, I've been asked that question several times. And what I've said is, to explain what it is like to wake up from a coma is the only way that you would know, the only way that you would fully know what it was like, or I could put it into perspective, was if it would happen to you and you could experience it. And I don't want that to happen to anybody. But I would imagine when I opened my eyes for the first time and I looked up, I could imagine that's what it was like to be born because I didn't know like anything. I didn't know like what even a person was. Like all I seen is like something walking over me, and I couldn't put it into perspective as to what was happening. Like I didn't know where I was.
So just this massive visual input of stimulus.
It was yeah,
It's
and
overwhelming.
yeah, and to the point where like that was like bench pressing 350 pounds, opening my eyes. Like you had like it was just too much. It was just too much.
Now, I remember you said to me that after a couple instances of being able to open your eyes, gain some more awareness, this urgency came to you of like, what day is it? Do I got to be at work? What time? Where are things? So then your life beforehand starts to kind of fade back in just when you have those moments of panic of, does my boss know where I am? What do I need to be doing right now? And then you just kind of set yourself to work to be able to find a way to get there. Like you put yourself into kind of an action plan right away. And like, what was the first goal you remember making?
Yeah, so that's what I did. I knew I had to set a series of goals because things were just, it was extremely overwhelming. And I know you get places by, you know, 1 foot in front of the other. But at that time, I couldn't even put 1 foot in front of the other. My first goal was to be able to sit up in bed. Like I want to sit up. That's goal number one. And then goal number two was to touch my feet to the floor. Just I want my feet to touch the floor because I hadn't touched the floor by this time it had been over a month. And then I said, okay, once I touch my feet to the floor, I want to stand up. I want to just stand. And then we'll see what happens. We'll see what happens after that. Then it's going to be like, okay, I want to walk to the bathroom. I want to walk. And of course, there was physical therapy in the hospital and they helped me, get from point A to point B. And they put me through, rigorous, just therapy of movement again. And I remember like the bottom of my feet hurt so bad that I guess what had happened was my plantar fasciitis or in the bottom of my feet had tensed up because they haven't had a lot of pressure on them. So they were like contracted. And every time I put any type of weight on my foot, it would stretch out. Mm-hmm. And that was like literally like pulling muscles. It was so painful. I remember being on a walker and I would put like every bit, all of my weight on my wrists and on my hands and try to like, relieve my feet.
And even that goal that you made of just being able to sit up in bed sounds pretty simple. But the reality is you injured your brain. And that part of your brain that you injured is responsible for controlling your blood pressure, your heart rate, all of those simple mechanisms you never think of. They have to be able to make adjustments in real time from when you go from laying down to sitting up. So if you had been in the hospital for something like appendicitis, your opportunity to then go from laying down to sitting up is not going to be affected, but you injured your brain. And with injuring your brain, that process becomes just so much more complicated and needs more training. And they literally had to train your body how to tolerate being upright. So in that time, of course, everything's going to get tight. If you're in bed for a long period of time, there's going to be some changes because you're not exposing your body to the normal stimulus and weight bearing and all those things that you need to be able to carry out simple functions like walking. But you managed to get yourself to the point where it was time to leave the hospital. And I remember your wife saying that at first they were going to place you in a rehab that specialized in brain injury. And then all of a sudden it was like, well, you have 24 hours to get him out of here. We can't find a place that'll accept him. So we were going to send him to a nursing home. And the process of getting you even from the wheelchair into the car for your wife to take you to the nursing home, she explains it as you were pale, nauseated, out of breath, almost as if you had just been picked up after running a marathon, just to transition that 8 inches from the wheelchair to the seat in the car. And that's where things were for you at that point, and off to the nursing home you went, and you kept your persistence of recovery in mind. What things stand out to you about your experience in the nursing home?
So let me tell you about the wheelchair from the car, from the wheelchair to the car. Like that was like so difficult, and at the time, I really wasn't processing or knew that I had a brain injury. I knew I was hurt, but I guess my brain was hurt. But your brain doesn't really hurt like you would think if you twisted your ankle. It's not that type of pain. It is a pain that you can't feel with your feeling senses, but you can feel it with your thought and the way you process. But the weird thing is that when your brain, you don't know that you're thinking like slower, or you don't know that there's something wrong because it feels normal. It's like you're in a dream, and the dream, you could be doing the weirdest thing in the dream, but it seems totally logical. Like you could be flying through space in a bowl of Fruit Loops, and that's like that seems
That's your reality.
that seems perfectly logical in the dream. And that's what it is when you have when your brain is hurt. Like everything seems not out of the ordinary, but it is out of the ordinary. And one of the processes, and to speak on that, when I was in the nursing home, essentially, which should have been a brain rehab, but it was a nursing home. One of the things, I was walking down. You would be helped to learn to walk down the hallway, and I would keep like bumping into the wall. But I mean, I thought I was perfectly fine. I was talking about like racing the nurse. I was like, I could beat you down this thing, and she's like, well, Travis, you're keep running into the wall, and you don't process that. It's perfectly. It seems perfectly normal, like like you were in a dream. It's all normal.
Yeah. And like it wasn't something on your radar to even know, am I staying in the middle of the hallway or am I scraping this walker all along the hallway just to be able to get down here? And from that point, you're able to get to the point where it's time to go home. So you land yourself back home, still struggling with life, functional tasks. For instance, you wouldn't be able to carry groceries in the car. You wouldn't be able to carry groceries in from the car. But even the process of going grocery shopping probably was incredibly challenging. Having to put a list together, remember where you're going in the store to be able to get it, tolerating all that visual stimulus in the store, the noise that goes with it, all the physical exertion it takes to get what you need, carry it all back inside. All of that was just out of reach at that point, but still persisted on, and you were diligent about doing everything you could for yourself. So they suggested that you follow up with some doctors on an outpatient basis. And one of the doctors you saw suggested that you probably need some more physical therapy, which was wise discretion. So you have all this going on, and then the doctor sends you to physical therapy, and this is where we first meet. And what did he send you to physical therapy for?
Yeah, so he sent me to physical therapy for my ankles, like ankle pain, like mobility, because it was one of the specific things. Like I noticed that, and not to say my ankles weren't hurt, they were hurt. When I got home, I kind of live on a little hill. There's a little hill that goes up to my house, and I had got to the point where I was walking straight and walking okay, but I had to walk on a hill. My ankle had to go from straight flat walking to walking up a hill, and that is a whole different bit of like muscles and mobility that I hadn't used at all. So that was like new instantaneous pain. And so they, off to outpatient therapy. And that's where I meet Abby for the first time and tell her, my ankles are hurting. And there was so much more.
Yeah, you're right. Like the ankles were hurt, but the best way I can give this example, and we encounter this a lot in the healthcare side of things, is there's a house on fire, and then the doctor's paying attention to the bush that catches fire out front. And in Travis's instance, the brain injury would be the house on fire. Now, granted, his ankles did hurt. There was limited mobility there. And that's something we could certainly address. But that was so minor compared to the massive injury that he had sustained, because as all of his other injuries healed, all these band-aids came off, he was still left with a severe concussion. And that part really warranted the most attention. But the doctor that he saw was an expert in putting out bushfires. So that's what that doctor saw, and that doctor realized could be addressed on the physical therapy side. But there wasn't this opportunity to treat Travis as a whole, everything that he would need to be able to get back to work. So that's where our paths cross, and that's what kind of makes this podcast a unique experience, because even now, a few years later, it seems obvious that if somebody hit their head hard enough to be unconscious for that long, to be put in a coma, and all the things that transpired afterwards, it seems pretty obvious that he had a brain injury and a concussion, and that part needs to be addressed. But even nowadays, there's just this lack of familiarity about what happens after you hit your head and what does it take for it to get better. And even as I ask ordinary folks that may be involved in sports or even in the healthcare industry, if you ask any of them, how long does it take to recover from a concussion? They'll say probably a week or two. Because that's the level of familiarity. That's how long it takes for a football player to come back, you know? But there's just so much more to it. And this is kind of a great opportunity to be able to discuss some of those things that Travis experienced, so that way our general awareness of what happens after a concussion can start leading folks to getting the appropriate care, instead of this doom of trying to deal with it long term or having to find their own solutions. So if you don't mind, we'll kind of discuss some things that you brought up to me that I think are important for folks to realize were the after effects of this concussion. So the first time you were home and you're starting to experience TV blaring, dogs barking, trying to focus on following directions to put something together, what does that feel like to you, even 2 months or 3 months after you sustain a concussion?
3 months after? It feels like this next day. Like there's 3 months is nothing. 3 months is the same, is like the same day, like zero difference, zero difference after 3 months.
Yeah. And because nothing was done to isolate and improve it, all the challenges that come with this, and especially, emotional regulation, being able to use all those coping mechanisms that you've learned throughout your life to be able to keep yourself in check. All of that just seems to kind of go out the window after sustaining a concussion.
Yeah, 100%. And that's like one of the biggest things that happened to me that I didn't even know until a couple weeks ago when Abby and I were talking about it, that so I knew it, but I was still in that dream where it seemed normal, where I would watch, and I noticed this, like when I would get home from, when I got home from the hospital, I'd be watching TV and there would be a commercial come on, like some, a fabric softener commercial with like the little bear. And I would see it and it would be so cute. And it would literally, I would be bawling in tears. Like, I'm just like, oh my goodness. Like, and I'm not that dude, right? Like never been like super, cry at movies, Okay. So I did cry a little bit during Simon Birch because of poor little guy, but that's totally different. So, but now, like I have this concussion and I'm crying at commercials because I didn't know that something was wrong with that. I was still in the dream where it seemed normal. And only, a few weeks ago when Abby told me that your ability to regulate your emotions goes away. And I said, well, that makes sense because who cries during commercials? Not too many people. So when I heard that, like, because look, that's not the only time you have emotions. When you're watching, when you see a commercial, you have emotions all throughout life. And imagine not being able to regulate them. So if somebody says something, or something happens, you don't just stop at normal. It goes and goes and goes and goes so far to the point where, you could do real, like bad things could happen, like, because you can't stop it. And I didn't know that this was happening. I was in this dream, and I could say that like life was not the best, because there was a lot of emotions that I was dealing with, and that's all I would do, is I would just deal with them. And when she told me that about the emotional regulation, the first thing I said to her was, "Can you fix that?" Because that's pretty tough.
The highs get really high and the lows get really low. And with your injury, an impact to the front of your head, the frontal cortex has a lot to do with our executive function and the way we learn how to cope with things. And it has a responsibility to communicate with our limbic system. And you were left with the only explanation of you had a diffuse axonal injury. But that meant nothing. What do you do with that? What does that mean for you? And in the recollection of what was happening, you didn't receive that explanation until much further down the line. But a diffuse axonal injury is when the nerves in our brain that have a responsibility to carry information from one nerve to the next. There's a cell body at the front, and then there's a tail along that nerve that has a responsibility to communicate to the next one. And I explained that tail as an extension cord. So the inner part is the wire that carries the electrical charge, and then the covering of the extension cord is the insulation that keeps that depolarization thriving throughout the entire tail of the nerve. In a diffuse axonal injury, there's shearing forces that disrupt the covering of that extension cord. So now we have electrical charge that can just escape at any point along that tail. So what is normally a series of networks that would allow you to recruit those learned coping mechanisms of when somebody says something that would make you angry, you have that internal voice that can start to change your perception of that. Once that part gets disrupted, that ignition now sets something in motion that can really get out of hand in terms of how you manage it. So something that would have been, that made me angry, but I got over it pretty quickly because I know it's a problem with them, not with me. Instead, it becomes something you internalize, and then it just starts to fuel and sometimes can even turn into rage. And that emotional regulation part is something that is so common. It lasts a long time until it's addressed, and it can be incredibly disruptive to day-to-day life. I shared with you not too long ago that around here we have Mid-Atlantic Concussion, which is our kind of go-to resource, and Dr. Schaller's the medical director there, and he told me a few years ago that the divorce rate is 50% higher for individuals who sustain a concussion. And as you had to live it and experience it, you can understand why.
Oh, we came close. Like it was like if it wasn't for my wife and her, just I'm gonna stay with you no matter what. She is like a cut above the rest, man. My wife, like, she stuck out a lot of stuff because there's a lot of things about me that changed, and I did, I would say I did get angrier quicker, and I probably said things I shouldn't have said, and she stayed right there, and man, to have a girl like that, like that is a blessing for sure. Like, what did I do to deserve that? Because and that certainly wasn't easy. That certainly was not easy for her, but like I said, luckily, man.
So you came home from that rehab probably a totally different person than who left to go to the racetrack that day.
That's what they said.
And then
it seemed like I was normal.
Felt normal, I'm sure. But her persistence to be able to find ways to get to know somebody new and then stick through this process of you, recovering day by day. But there were things that just didn't have a name that you were experiencing. You didn't know that I had an injury to the front part of my brain. So the way I think might be changed for a little bit, but there is a way to find solutions out of this. But not everyone has that kind of luck to find somebody who can stick through that for years to be able to allow the healing to take place that needs to. And your skill set is remarkable in terms of how you are inquisitive into your own mind, and you've dove headfirst into philosophy and understanding what goes on inside me to be able to allow this sort of outcome. And through that, you've been able to kind of navigate this. And that's a lucky factor too, that you had that resilience and resolve to see it through. But I'm sure it just makes so much more sense to you now when you hear about individuals who are in the military who sustain blast injuries, or people who experience a career maybe in athletics that involves a lot of head impacts, why suicide rates are so high. You know, if those lows get so low and you don't have that coping mechanism, that changes your life.
It changes your life. It changes who you are. It changes how you think about everything. It changes the fact that, so prior to, say, something as horrific as suicide, you know, most people think that that is like, you know, how can you do that? How can you leave your family? And how can you, you know, just take the easy way out, some people say. And suicide is generally considered, you know, one of the most horrible things that somebody could do. Now, think about this. That person who commits suicide is dealing with worse than that. They're dealing with worse than that. So all that stuff, the worst things, you know, oh, he took the easy way out. He left his kids behind. How could he leave his family? Because that is not as bad as the person who is internalizing these emotions, who just maybe doesn't understand they're in this dream of this is reality, and they don't know that they can correct it and get back to normal. So yeah, it's not good. And like, one of our goals here is to really get that information out and help people in that situation to know, hey, you might be just dreaming right now, man. Like, we can get you back. Like, there's hope. There's hope for you. There's a possibility. It doesn't have to be like this.
And through our discussions, we've kind of had to find a way to, how do we identify what it is that is lacking in our general sense of familiarity? And I remember this resonated with you a lot, that I said, if we could put a cast on somebody's head, there would be a lot fewer dumb questions, because you could see that there was an injury. You know, someone who breaks their leg and goes back to work 4 weeks later, we're not signing them up to run down the hallway, chase down, you know, whoever it is that they encounter in their workforce. But we foolishly have the expectations that after someone injures their brain, that they're going to go back to multitasking, high level concentration, the ups and downs of the emotional ride of what it means to have that sense of responsibility and manage a family and all the responsibilities of work and life outside of work. But we don't have that cast on the head. So instead, we need to make these things more familiar. And for instance, there's a lot of times in high school sports, college sports, or even just in recreation, that a parent will say, you know, their kid is now just not doing well in school, acting out more at home, really withdrawing themselves from all those social engagements that they used to enjoy, and they're just noticing a massive change. And from my lens, I'm starting to ask, well, what's happened with him recently? When was your last encounter with your primary care doctor or urgent care? Like, oh, well, he separated his shoulder in football about 3 months ago. If he hit the ground hard enough to separate his shoulder, what happened to his head? Was there a whiplash or a head impact or something else that went along with it? But when he goes to that urgent care setting, they might take an x-ray of where he's complaining of the most pain, which would be the shoulder in that case, and they see an injury to the shoulder. That's oftentimes where it stops. And all the sequela of what happens afterwards is just not on our radar. But if we can make this a little bit more familiar to teachers, coaches, parents, siblings, the opportunity to intervene before that kid's life changes, sometimes to an instance where they don't really have the words or skills to pull themselves out of it and get the care that they need. If we can start to find language for that, and new detection systems where people just are more aware of this could be what happens, I think we really have an opportunity to start changing the perspective around it. Because I can say for certain that if you want more accountability in the healthcare system, it comes through the general public's awareness. If you know what it is that's going on with your kid, you're going to be the one advocating to your doctor that this is what's happening. We need to have them assessed by a concussion specialist or psych, anything of the sort. They're the ones that really put it to the doctors to have that path pursued, versus the doctors being able to know that there might be questions they need to ask that wouldn't necessarily be on their radar, because in their profession, their job is to put out that fire in the bush, or their job is they've been trained to detect fires in the garage and they put them out there. They don't have that opportunity to see things differently because of their training. And no one in the healthcare field is out to be negligent or not do what's best, but they've been trained so well in their zone that sometimes there's not the opportunity to look more at the whole picture of the house. So I'm glad that you're comfortable enough to share those experiences, because that means an awful lot. And your experience was traumatic brain injury. Obviously, it was a very severe concussion. And those can wreck people. It can ruin their lives, on the personal side, professional side, and everything else. But your diligence with being able to understand yourself and kind of see through it gives us the opportunity to sit here and kind of talk about it in a new way. So I'm really excited that you're at this point now, because I think even 4 years ago, it might not have been at this point where we can talk about it in a constructive way.
Yeah, probably not. Yeah, it takes so they she had mentioned, like, you can go back to, whatever sport you're playing, and you seem to be healed from a concussion after 3 months or whatever. It's been 9 years, and I'm still healing. Like, I'm still not. I just recently, like I said, just recently I found out the emotional thing. I didn't know that, and that is such a big, huge deal for me. Um, it takes so long, and you need to have so much knowledge, or you need to be your own advocate, when something happens, like Abby said, like I dive into stuff, and I wanted to learn everything that I could about the brain and the body and how it works. And what I learned was that you could literally, like, the body is so complex and the brain is so complex. You could literally spend your entire career working on how your hand works. That is real simple to do, but there is so many things that make that happen, from neurological, pathways in your brain, down your CNS to your PNS, down through all the nerves in your hands and how they operate. You could spend your entire career learning this. So it's understandable that people want to focus on the bushfire, because the bushes are they're very complicated. So you have to be your own advocate, so it's very important to learn the signs of concussion and what to look for. And that's one thing we're trying to do here, to help you be able to be better advocates for your children who may play sports, or your husband or your wife who has suffered, a traumatic brain injury, because, doctors, they're it's very complicated. It's very complicated. So they can't find everything.
And they're all out to do their best. No, no one's out to be malicious, but the concept of advocacy, it falls on all parties responsible, whether you're on the healthcare provider side or on the person seeking healthcare side. So for instance, this was a while ago as well, but I had this 23-year-old, very high achieving individual, who, was going to school for a profession in healthcare, was working a very demanding job. And unfortunately, she sustained a concussion, and she did the right thing as she knew it. You go to see a doctor. In this case, it was an urgent care doctor. And even to this day, it still happens. If you go to the urgent care, they're going to give you a work note to be out for about 3 days. And, they'll instruct you to follow up with other doctors, oftentimes your primary care. And I happened to see her on day 3, and she was supposed to go back to work that night. And she came in, and it was towards the end of my shift. But I remember so distinctly that She was sitting in front of me and her head was wobbling from side to side. She was doing her absolute best to get her eyes to be able to fixate on where I was to have that visual clarity. And her head was just swimming back and forth. Her pupils were dilated. Her resting heart rate was in the 160s. And it was raining that day. And she couldn't figure out how to put the windshield wipers on in her car. And we're talking about somebody who's incredibly high achieving. Then it becomes my responsibility to be the advocate. How do I find a way to be able to keep her safe? I knew she could not tolerate going to work that night. I knew that there were much greater things at stake. So I needed to go to her physician's office, lay out everything that I saw. But keep in mind, we don't have a clear test. We don't have an x-ray that shows this person had a concussion. Even if they did a CT scan, which is common practice, that concussion's not going to come up there. They're just going to show there's no active bleed, but those consequences are still in place from that concussion. So kind of set this trajectory of, if we want things to change, you have to be well informed. You have to really dive into this in a purposeful way to find out what's going on across the country. Who are the experts in the field? What are they talking about? What are they paying attention to? And this journey has been ongoing. And Dr. Schaller that I mentioned from Mid-Atlantic Concussion, he's been on this path for over a decade. You know, he has been making it his mission to educate other doctors, neurologists, athletic trainers, everyone involved in the care of an individual who is more likely to sustain a concussion. He's been trying to make this language and these signs more familiar. And he also has the most objective testing, which started to change my understanding of concussions, of how do we objectify when someone's balance is off, and what does that mean for the brain? How do we objectify somebody who has trouble with short-term recall or visual spatial awareness? All the things that go into the complexity of how you exist in a day-to-day world. That part is inspiring to me to find out, how do we make this familiar to everyone else? And Jimmy McKay also says science isn't finished until it's understood, but concussions are so complicated, finding a way to understand them is not that easy. And, you know, if you've seen one concussion, you've seen one concussion. They are all so different, but they require you to really be interested and invested in the individual to be able to figure out, how do we help this brain heal? So all that has been a neat path in my career, and also the realization that as a physical therapist, we have a real advantage of time and relationship with patients. So when you go to see your eye doctor, you see them for maybe 15 minutes once a year. You go to your primary care doctor, see them for 5 to 7 minutes, maybe once every 6 months. And then even if you're seeing like a psychological counselor, you get to know them pretty well. You're with them for about an hour a week. You develop a relationship. On the physical therapy side, we see folks usually about 3 hours a week. And we're often seeing them in a time where something's changed in their life, and often not for the better. And through that, we have an opportunity to get to know somebody. How are we going to help them if we don't know what's important to them? So we really get invested in figuring out what's important here. How do we be able to have the same goals? And on my side of things, it's like watching a new series on Netflix, and you can't wait for the next season because you want to know what happens with that person after they leave your doors. Did they end up getting that dream job? Did they end up getting back into that sport? How well are they doing there? Just so much curiosity, but thankfully through our connection, we were able to cross paths again and answer a lot of those questions, but we'll get into that more next time. But this was a neat opportunity to kind of answer those questions in terms of what could have gone differently and what did it mean for you long term.
Yeah, absolutely. It's like I said, luckily, you know, our the intersections of our paths, you know, we meet after the accident, and usually you just never see each other again. Like,
Mhm.
I never see the doctor who operated on my carotid arteries, great doctor, never seen him again. You know, never seen him again. Who knows? But luckily, Abby and I, you know, we reconnected through just, you know, maybe that was like supposed to happen. You know, sometimes, you know, people believe in you know, people don't believe in coincidences. People believe that everything is like destined to be, and maybe this was all meant to be. Maybe I was supposed to get in my my motorcycle accident so I could meet Abby, so that we could reconvene again later and be here talking to you right now. Like, maybe this is to help. Maybe it was all to help you.
And a lot's changed since we first met. You know, at that time I was a much younger clinician and still navigating that space of how do I advocate for somebody that's facing a much bigger house fire, so to speak, and we're worried about something a little bit smaller. And it's very humbling within the healthcare space, because once you start learning more, you realize how much you don't know. So this had to be a full-on investment from my side in terms of, how do I find out more? How do I get to the point where I can treat with more confidence and have a better understanding of what's going on with the person in front of me? And back in 2021, that required a little bit more of a pivot to find a way for this all to coexist. So I love treating in an outpatient clinic, and that's where I experience most folks that are on the concussion side of things, whether they're in athletics or even just general population and happen to sustain a concussion, and sometimes as early as 2 days out, sometimes as long as 3 years out. There's a vast variety there. But I've always worked in home-based physical therapy as well. So I needed to find a way for that commitment to coexist and still have an opportunity to explore more about the concussion side. So I found a way to meet a need in our community for the home-based physical therapy that allowed a little bit more flexibility on my end. And I'm just lucky enough right now to work with the best home-based physical therapist that I've ever encountered, to be able to build this system that takes care of folks in our community in a post-surgical basis. But doing that allowed me to find ways to travel to conferences, go spend time with experts and sit in their clinic and watch what they're doing. Collaborate with other folks that are interested in what I am, find researchers that are doing the groundbreaking work that could find better solutions for us or allow us to be a little bit more proactive than reactive on this side. And then in 2022, there was the WNBA finals, and it was Sue Bird's last year. Sue Bird is one of the best basketball players of all time. Now, she's out in Seattle.
Probably way better than me. I'm horrible at basketball.
Safe to say, who's better than you, better than all of us. And I've always felt that if I'm going to stay motivated and I'm going to be good at what I'm going to do, I need to be around other people that are excellent at what they do, because there's a certain level of inspiration and motivation that you get from others that have found a way to be the best at what they do. So if game 3 of the 5-game, they were in the semifinals at this point, happened to fall on Labor Day weekend. So my wife and I decided we're going to drop everything, go out and watch this game, because it was a chance to witness excellence. And there was a lot at stake for her in this game. You know, in the semifinals, your career could be over if the game is lost, or you could go on to possibly play in the finals. And what a way to go out for that. And we're watching the game. It's incredibly excited. They were playing the Las Vegas Aces. And the whole time I am just laser focused on this player, Gabby Williams. So she's an excellent athlete. And I noticed that she wasn't even tracking the ball well. Like, as it came into her hands, I just noticed something was off with her eyes being able to track the ball. She was pretty withdrawn, like in timeouts and things like that. You can just kind of see her like turning into herself a little bit. So hop on my phone, search her name. It turns out she had just been cleared off the concussion protocol. Obviously, I'm a lot more attentive to these things. You know, when I'm watching a basketball game or a soccer game, I'm watching for these signs, because this is my day-to-day scope. You know, this is what I'm looking at. How do the head and the neck affect, function? And it's kind of like if I painted cars for a living and I'm watching Fast and Furious, I'm going to be attentive to how well did they buff that paint? What's the contrast like? You know, all the details that would go into that. So that's my experience watching sports. Really attentive to the head and neck. And
whereas most people are just watching if they get a basketball, right? You know, if they make a basket or if they score a touchdown or whatever. You're watching like how their heads are moving, and yeah, that's awesome, man. That's awesome.
So throughout the game, it's a really exciting game, and like I said, we're there witnessing excellence. We're watching like Sue Bird, execute this game with just the utmost precision. And as I'm watching Gabby Williams, and she never was like the highest scorer on their team, but her influence was disruption. She was such a good defensive player because she could anticipate where the ball went. Her hand-eye coordination was phenomenal. And watching this game, it was just, she was like a shell of herself, you know? And I can't help but think, you know, how does this influence the whole team? How does this influence play? And how is Gabby coping with this? Because she's got to be aware of it too. And even in following games, I noticed that, you know, she was wearing earplugs and trying to eliminate some of that bothersome stimulus. Now, Gabby Williams, just this past season, was Player of the Year in the Euros. She is phenomenal. So what was that experience like for her to be in a high stakes game back in 2022 and realizing that how she normally plays is muted or just a little bit different? What if she had someone in her corner or within her staff that knew what happens after a concussion and could have her do X, Y, and Z that would eliminate those effects of how she's going back into play? So on the flight home, and by the way, it was a really exciting game and went into overtime. Suber made this clutch shot with 2.7 seconds left in the fourth quarter. And it just really was, it was such a great experience to be there to witness it. They didn't win that game, but still it was just neat to be able to witness someone that's changed the game. And we got to be there in person and watch it all unfold.
And maybe she didn't know that she wasn't tracking the ball. Like, I didn't know I was running into the ball.
Yeah, exactly. And like, you don't have words for it. You just know it's difficult. You don't have words for my convergence is off or my peripheral vision is suppressed. You don't have, that's not something that's coming to mind.
Yeah. I don't know what that means.
Exactly. So on the flight back, I'm, drafting up some emails and trying to send these out to professional sports teams of just, hey, what if you had an opportunity for enhancing this recovery after a head impact? Because you're surrounded by incredibly talented athletic trainers and physical therapists, but they have such responsibility of taking care of the whole body that there's no way they could be an expert in everything. They're the master of perhaps how the upper extremity, and they're so good at that. And to be fair, if you hurt your elbow and you're an NFL quarterback, don't come to me. I'm a physical therapist, but I'm not good in that realm of physical therapy like I am with the head and neck side of things. So there's an opportunity for folks to be, experts in their own way and find their own little niche within the human body. And then that started this emotion of I need to continue to find out more and find opportunities and kind of bring more awareness, especially on the professional sports side of things. And it was all a very humbling experience to realize how decisions are made in professional sports, but I still wanted to stick with it. And then in 2023, the U.S. women's national team was playing a friendly, and I remember everything about this game as well. It's funny how these things will stand out in your mind because when important decisions are made or when left an impression on you of this is a call to action. And my wife and I were watching the game, and we had my younger nephew with us at the time. He's probably 3 or 4 at the time. He doesn't care about what's going on in a soccer game. So he's getting a little antsy, and we're like, all right, well, let's take him down the park, right on the swing a little bit, and then we'll come back and watch the rest of the game. And right before we head out the door, Mal Swanson, which, by the way, before she got married, her name was Mal Pugh. And if your name's an onomatopoeia in professional sports, keep it. Yeah. She would take off with the ball, and the announcer would be like, pew, pew, pew. It made it so entertaining to watch the game. But she's now Mal Swanson. So anyway, she's a very aggressive player, made a huge influence on the game for the national team. She was going after a ball that was going towards the other team's goalie, and she hits the top of her head on the goalie's leg in a big collision. So the athletic trainer goes out, assesses her, and in soccer, you don't have the luxury of just swapping people in and out. You're limited on how many substitutions you can make, and if that player goes out, they're not coming back in. So you could influence the game on a strategic side by making that decision. There's a lot of pressure there. So they decide to keep her in. You can tell her neck's still bothering her. It was a hard enough hit. And I'm not here to say she was concussed or not, but I just know that head impact was there. And I know what that does to the top part of the neck. So we continue on out the door. And I said out loud to my wife, I'm willing to bet my next paycheck that's going to result in a lower body injury before this game's over. We come back from the park. And sure enough, Mal Swanson is being stretchered off the field with a horribly traumatic injury, rupturing her patellar tendon. And knowing what I knew about the relationship between concussions and lower body injuries, I started to realize how foolish it is of me to know this and know that something like this is coming, and know that I'm not doing everything in my power to get that information to the people that need it. If it's to the point where it's almost predictable, there's an obligation there to be able to find a way to make this information more accessible, more familiar, and something that's going to carry this kind of influence.
So it's twofold there. It slows down your ability to react emotionally, like normal emotion, and it slows down your ability to engage your quad fully to be able to stabilize yourself so that you don't hurt tear your ACL or something to that effect. So this is I think this is going to be a great journey for us, and we are
explore why that happens and what the connections are. And it's important to realize as well that the research that's been done doesn't all of a sudden change practice. So Dustin Grooms out of Ohio did a marvelous job of illustrating, why does this happen? Why do athletes that sustain a concussion become more likely to tear an ACL or injure their lower body? And his work was reflective of, back in 2021, Dr. Gilda released this historical study where he pulled back information from NBA players. So what he found was, a player in the NBA, say they sustain a concussion, they're pulled out of the game, they're cleared by every medical expert they have on that team. So they're put through a concussion protocol, and some doctor decides this person's better and puts them back on the court. And again, they're doing everything by the book. Once that player...
What is a concussion protocol?
So a concussion protocol is multifaceted, and it's meant to figure out where their symptom threshold is. Can they run without getting a headache? But it's all symptom based. Did they throw up after they did that? Did they start to keel over? What's going on after they experience that challenge? Now, we've learned that what we're doing on the concussion protocol side is maybe not as comprehensive as it needs to be. But at the time, everyone is doing what they're supposed to do. And once that player was cleared to go back into the sport, they are 450% more likely to come out of play again for a lower body injury. So what are we missing? Everyone did what they were supposed to do. What's missing in that junction? So like I said, Dustin Grooms did a great job of making this visible to us. So he used a functional MRI machine and had athletes that were concussed and ones that were not concussed, and had them perform a leg press motion in the functional MRI. And he was able to illustrate that from one specific area of the brain, there was a direct connection from there to the primary motor cortex that allowed him to execute that lower body motion. And then the athletes that were concussed, that signal was going to areas of the brain responsible for concentration, for visual information integration, for sensory motor control, for all these different aspects that otherwise would have been streamlined, are now resorting to different areas of the brain to be able to perform that same function. So the analogy I like is that if I'm sitting here with a remote control and I hit a button on the remote, it goes right to the TV. So we have a direct point A to point B consequence. Okay, so signal in the brain, motor output. The individuals that have sustained a concussion, that remote control is now bouncing off of mirrors before it gets to the TV. So that signal needs to go to different areas to be able to find that same output, that same outcome. So within that, he was able to show that this is where that process gets disrupted, and this is where we have the susceptibility of this lower body injury. So in the example of Mal Swanson, in her scenario, that impact could have caused a little bit of change in terms of swelling or nerve communication. In this instance, it was like the nerve communication from the top of the neck disrupted that pathway that would allow her to otherwise plant her foot and push off and change direction. That exact precision of motor firing that needs to happen to do that became disrupted, and her hamstrings didn't shut off in time, and it was enough force to be able to tear her patellar tendon. Now, this is something that, she probably doesn't even know those two things are connected, that she hit her head and then ended up having this horrendous injury. And certainly nobody else that was making decisions on her behalf had any idea that these things were connected. But this influenced the team. And it's within team culture that you don't focus on whoever got hurt that would have otherwise been able to change the game or the future games. But the US women's national team went to the World Cup that year and it didn't go their way. Now, it's not to say that it's because she wasn't there, but I'm sure they wouldn't have hated to have another excellent power forward that scores a lot of goals for them on the field. But it's all to say that there's opportunity for the awareness of these connections might start changing how we make decisions about what players do after they hit their head and how we best prepare them to get back into the game.
I didn't know. I thought it was normal to cry at like a Snuggle commercial. So I definitely would not know if my quad or hamstrings were getting the wrong signals from my brain.
Right, right. It's not something you can necessarily feel.
Right.
Maybe if we continue to talk about these kinds of things and bring a little bit more familiarity to it, it might be something that now the athletic trainer is assessing their coordination or their reaction time before they go back in, just to be able to help cut down some of these non-contact injuries that are happening after head impacts.
Yeah, it's like if you go to the doctors or you go to the eye doctor and you're trying to get your prescription for your glasses, you have a definitive test where everybody knows the top letter is E, and then the sequential letters are whatever they are, but you know what your precise prescription is if you can't read this line. Your 2015 or 2025, whatever it is, but there's no definitive test like that for concussions. So what type of glasses would we give somebody who had a concussion? There's no test for that like there is if your eyesight's bad.
Exactly. And like your example of that is excellent to be able to show that because we have familiarity of what it's like to have bad vision, we already know what the solution is. So if we see somebody sitting 6 inches from a sign trying to read it or squinting all the time, our automatic instinct is you need to go to the eye doctor, right? We don't have that for what post-concussion symptoms can be like. We don't have that level of familiarity to be able to instinctively know without any sort of expertise, you need to go see a concussion specialist. And unfortunately for athletes, as they go through their experience of play, sometimes these symptoms are kind of lingering in the background. The emotional regulation side, because of a series of small head impacts, might start to compound, but they might not have that opportunity to realize, like, if the anxiety or depression is feeling like it's much different than it was a couple years ago, I wonder if there's a doctor or a specialist I need to see to be able to get this part back on track. And then to go along with your glasses example, you said to me that when you were going back into work and people would kind of have that expectation of you of, why don't you just do this? Or why don't you just find a way to do this? You used to be able to manage 2 or 3 things going on at the same time, send lengthy emails, organize people. Why don't you just do that? Or why don't you just remember how this goes? And you said it's like telling somebody who needs glasses and they don't have them, why don't you just see? It's not that easy.
It's not that easy. And having glasses, like, you can definitively see that person needs glasses to be able to see. And there's no stigma. There's nothing wrong with that. Some glasses look really good, but if someone has trouble regulating emotions or they have a brain injury, you can't see that like you can see if somebody needs glasses. So I can clearly see, okay, so somebody needs glasses. She needs glasses, but I can't see what your vision looks like. I can see you need glasses. I can see if you have a cast, I can see your legs hurt. I can't see how I can't see how you see. I can't see how you see the world. I can't feel the world like you feel the world. So having a brain injury, like, is very, it would be easy to cast that off and say, well, they're just, they're one of those people that need a safe space, or they're just using their emotions to, they're just using their brain injury to try to gain sympathy or to try to take advantage of the system or get out of something, because you can't see how they see. You can't feel how they feel. So you really wouldn't say that about somebody with, who's wearing glasses, like just see, or I see that you have a broken leg, just walk,
Mm-hmm.
you know?
Mm-hmm. Yeah. And I'm hoping that, as we continue to dive into the different components of it, we just allow a touch more familiarity as to what it's like when somebody's experienced that. So we don't just think that somebody is withdrawing from what they normally do or becoming more frustrated at things that used to be easy for them. We start to think about it a little bit differently, especially if that person is involved in sports or recently had a fall, or anything of the sort that could kind of allow us to intervene in a way that's a lot more productive, because brains get better. They're amazing in terms of their plasticity and how much they're constantly developing new connections and rewiring. And we can use better understanding of what's going on to guide better treatment.
Yeah, neuroplasticity. So like Abby was saying, when my brain is hurting, things are going kind of weird. Like I delve into learning stuff about how the brain works and how the brain functions and how neurons fire and how they use, like, down to the fact where they use like sodium and potassium ions and axon potential or action potential, and like really delve into it. And one of the things with neuroplasticity is, the best way I can explain it is, like, your brain, the electrical signals that go throughout your brain have a certain path they go down, and they've probably went down that path since childhood. But sometimes you get an interruption and it can no longer go down that pathway. So it has to find a new pathway. It's kind of like you drove home a certain way every day for years and years. And then all of a sudden there's a detour and you have to go around. You have to go a way you've never went before. With the experience, or with what we're trying to do is, or what I was trying to do is learn as much about that as possible, and basically learn, like, neuroplasticity is kind of like your brain having a GPS. So it can kind of navigate around the blocked road and still get you home. But you may experience all kinds of new things as that electrical signal goes down a different pathway, just like you would experience different things if you went a new way home.
Yeah, I think this is gonna be a lot of fun to explore this, because you're already just so knowledgeable about many different aspects about how the brain works. I think we can really find a way to make this science more relatable, so that way there's a recognition behind what could go wrong and what can go right. How do you fix it? Like what's going on behind the scenes? Because that was a perfect example of how that rerouting can exist, and how it can create some challenges along the way, and then how you exploit the fact that the brain can find new paths to be able to get the desired result there. But I'm looking forward to continuing to speak about this and explore all the different areas that we can find more familiarity for folks to relate to.
Yeah, I'm excited. I'm just up nights thinking about new things to present, and I was up early this morning making sure everything was right. So I haven't been this excited about something in since I raced motorcycles. I kind of went into this mode where it was just bland and nothing really looked. There was no opportunity and everything was just gray. And now, like, there's a light on the horizon, and it is so good. Like, I am so happy. I am so excited about this. And this, I promise, will be some of the best information that you will get on concussions and brain injury, and just crazy fun stories about, like, maybe cars in rivers.
All sorts of things.
That's coming.
And maybe I'll kind of share some of my lens and perspective as well. So, like, for instance, there's high stakes football games this weekend. We're in the playoffs, okay, right? So in this area, everyone's really watching, what are the Eagles doing, and how's this all going to play out for them? And then their quarterback, Jalen Hurts, was just out on concussion protocol. So he came back the last game, and scientifically we know within the first 90 days of him returning that he has a significantly higher risk of a non-contact lower body injury. So this science applies to what you're going to see in your day-to-day life. If you're a sports fan or even just to have kids that play sports, there's a lot of opportunity to learn about how this affects an individual after sustaining a concussion. And we'll kind of go through all the nuts and bolts of how those things are connected there. Yeah. So I look forward to doing another one, and we have a lot of things to cover that I think are going to be very exciting.
Yeah. Awesome. Thank you so much.
Yeah, thank you for putting all this together, and look forward to talking more.
Yeah, awesome. If you guys have any questions or comments, please leave them below. We're more than willing to read. So I'll read every single comment, and we'll address them on the next episode. Maybe we'll pin some really good ones at the top. So yeah, this is awesome. Thank you so much, and
we'll see you soon.
See you later. Catch you later.